There we go. Secretary McCamley, I will pass it over to you. I'll let you introduce yourself and all of that.
Hello, my name is Bill McCamley. I'm the Secretary of the New Mexico Workforce Solutions Department. For many of you, that means we run the unemployment program. That is the most ubiquitous part of our department, but I would also say that that's not the only thing that we do. It is our job to get people back to work as well. And so I know that's one of the key issues you want me to talk about today. The other issue I'll be bringing up is the fact that we oversee the New Mexico Human Rights Bureau. So if someone has an employer issue and feels they are being discriminated against based on race, gender, sexual orientation, religion, et cetera, and so on, all the things in the New Mexico Human Rights Act, they bring it before our Human Rights Bureau for that complaint to be processed. So Amy said that you wanted me to go over a couple things. Let me just kind of give you an overall situation of where we are at right now and what our generic plans are going to be moving into the future. We have about 122 or 123,000 people that are receiving payment on 4 different unemployment programs. That includes standard unemployment. It includes the Pandemic Unemployment Assistance Program that Congress put in through the CARES Act for the self-employed, gig workers, those types of folks, people that are not what we call monetarily eligible for standard unemployment. It includes 2 extended benefits programs. One is called Pandemic Extended Unemployment Compensation. That's an additional 13 weeks of unemployment benefits on top of the 26 weeks that you get through your standard benefits. And there's actually an additional unemployment benefit as well for another 13 weeks. So that's the first one's important because a lot of folks got into unemployment in the middle of March. It is now the middle of September. People are going to start, a large chunk of people are going to start hitting their 26 weeks of benefits that run out for standard unemployment next week. And so they're going to start changing over to the extended program. I will say though that as the virus numbers in New Mexico continue to be flattened, thank God, the purpose of our department is going to shift from just processing and working on unemployment to getting people back to work and back into the workforce. And there's some different ways we are looking at doing that. The first is that we have waived work search requirements for unemployment. We've been pretty much one of the most flexible states in the country for this program. We waived it, I think, the Monday after the health emergency was declared. So starting on March 15th, we took that out of the way because, hey, look, we're asking people to stay home, stay safe. It was our intention to bring those work search requirements back in July, but unfortunately that date coincided with the spike in the virus where we had to kind of put some back into place at the state level. So we continued to do work search requirements, but moving over, it is our intention to start looking very seriously about making those a requirement again. And what that means is if you are on unemployment, when you certify every week, you're having to search for work twice during the week. And you have to tell us who you were searching with, give us some contact information, tell us what kind of job it was, that sort of thing. So we're not ready to release the date yet, but if the virus numbers continue to stay low into the next week, we will be starting to push that out a little bit more. And we're kind of basing a lot of our activities around that, right? And so as people start looking to, as we start saying it's okay for people to start looking for work, we then start really giving resources to folks. So what are some of those resources? Jobs.state.nm.us is our workforce solutions jobs site. It is the most comprehensive jobs board, for lack of a better word, in the state of New Mexico. Because what we do is spider, which means we take all the jobs from Monster.com, Indeed, Glassdoor, basically all the folks that do jobs in the state, we bring them into our website. And so it's a great place to look for work. We actually have a YouTube site where we have done a very easy to understand step-by-step instruction video on how to upload a resume or plug a resume into our website and then get people into the job search mode. We have also started doing a lot of workshops for interviewing how to write a resume, and then an overall one on soft skills. For those of you that are not familiar with what soft skills are, it's your ability to communicate, your ability to show to work on time, to wear a button-down shirt. What we find a lot from employers is that the lack of these soft skills is one of their biggest complaints. You know, people don't do anything but this all day. They don't know how to actually communicate as a team. They write their resume in text message language. I'm actually finding that a lot. I get probably anywhere between 20 and 100 emails a day from people pleading about unemployment, and half of them are coming in, you know, without using punctuation. And I can honestly not understand what they're saying. They're using emojis in a communication thing for me to try to figure out what their situations are. So that's really, really important that we start doing that. We have those workshops every week, and we're going to start pushing those out a lot more. In terms of the specific types of programs we're bringing out, I know Amy wanted me to talk about apprenticeships. So when I first got this job almost 2 years ago, one of the governor's biggest priorities for me was to really expand the amount of apprenticeships that we have in the state. And our goal was to move from around 1,700 apprenticeships that we had early part of last year to about 2,200 apprenticeships in the summer of 2022. We were well on our way to doing that, and then the pandemic hit and it kind of backed up a lot of our efforts, but we're still proceeding with a program that is providing a lot more support for current apprenticeship programs. So that's what we find is there's a lot of dropout in the big apprenticeship program. So any of the, even union, non-union, it doesn't really matter. There's a 40 to 60% dropout rate in those apprenticeship programs. So we actually got a grant from the federal government and started hiring counselors on to keep people in those jobs as much as we can. We also want to increase the amount of apprenticeships we have, and that just doesn't include the trades, which is what most of our apprenticeship programs right now, but say, how do we do an apprenticeship for early childhood? How do we do more apprenticeships possibly for healthcare? Can we do more work with the apprenticeship model for just outside the box type economic areas? Other states have done that fairly well. We have not been as great at that, and that's what we're looking at. One of the issues that we're finding, and this one I'll talk about in a second as well, with apprenticeships is gender roles. 97% of the registered apprenticeships in New Mexico are taken up by men because most of them are trades, and that's considered a male job, when that's really inefficient. And you know, one of the things we really want to start pushing is it's great for women who want to go and be an electrician, be a sheet metal worker. I mean, there's nothing about being a woman that says you can't do those things, and this is a great way to get an education and a skill and a job that you're going to have for a long time, and do so in a way that you're not going to go into debt doing it. In fact, you're going to be paid while you are learning. That's a big deal. I'll talk about that more in a second when I go on to our second thing, which is the work we're doing with higher education. So the 4 big job areas that we see as needing work in the next 10 years are the trades, and I just talked about that with apprenticeships. So electricians, plumbers and pipe fitters, steel workers, all those kind of construction jobs. We need more skilled workers every day. In fact, if you're one of those workers right now, you are working right now if you want to work. In fact, the head of the Plumbing and Pipe Fitters Union was saying, I can't find enough people to go down to Eunice right now and make a ton of money working at the uranium enrichment facility down there, because there's just too much work for not enough people going around. The second one is healthcare. We need workers from nursing assistants all the way up to brain surgeons, up and down. In fact, nursing, registered nurses, is the biggest gap we have in our state right now when it comes to amount of jobs available versus people that are there to fill them. And that's one of the specific things we were working on before COVID to try to address. That's not only good for people who want to get a good job, make a lot of money, but when we have a nursing shortage, it's really bad for the health of our constituents and the people that are living in New Mexico. But we need nursing assistants, we need medical technicians, radiology technicians, docs, especially general practice docs and specialists and all that sort of thing. And we need that pretty hard. The third issue is education. You guys have probably seen in the papers lately, there is a large teacher shortage, especially for special education. That's a big deal, but we also need a lot more STEM teachers. In fact, I think, don't quote me on this, I'm sorry, this is being recorded, but I believe the numbers I saw from a couple of years ago was only like 30 to 35% of math teachers in the state are actually accredited to teach math. The rest of them are kind of saying, hey, we need you to try to learn how to teach algebra. Will you please learn how to do this? So that's a big issue. And then bilingual teachers. We need a lot more of those folks too. I would also say we need early childhood teachers. That's a big deal. of the biggest issues there is pay. A lot of the early childhood teachers working in childcare centers are paid very, very low wages where, if I go to Walmart, in a lot of places I can make more money. And so that's one thing we're going to have to really work to address. Let's see, 1, 2, 3, fourth category is STEM and IT. We need a lot more engineers. I mean, every kind of engineer you can think of, we need more of them. We need a lot more technicians that can work in advanced manufacturing, folks that can work on cars, all that sort of stuff. But we also actually need, this was an interesting one on our list, we need more bioscience people that can work out in the field, that can work in our forests, work on our public lands, that sort of thing. So, and we need a ton of computer programmers. And as we see the economy start shifting, and I'll end with this and go more into depth with it at the end of my little talk here, we're seeing some jobs go away, and we're seeing a lot more need for certain jobs. So we're doing a Zoom meeting right now, whereas I may have come, 5, 6, 7 months ago before you in a committee room in the Capitol and given this presentation and purpose. Well, we're doing this by Zoom. So you need a lot more computer programmers, people that can do IT security, folks that can do developing of different programs, app things. So we need all of those. And those are the 4 big areas in the state. One of those, as I said before, can be addressed through the apprenticeship programs. The other 3, you need some kind of higher education something. And the reason I say something is 97% of the jobs that have been created since the end of the Great Recession have required more than a high school degree in the United States. But that doesn't necessarily mean you have to have, a bachelor's degree or a master's or a PhD. You can have a commercial driver's license. You can have an associate's degree in welding, or you can be like my girlfriend, Deanne, who has a radiological associate's degree from Dunyana Community College. I have a master's from Harvard, which is pretty good. But until I got this job, she was making way the hell more money than I was. And when we moved up to Santa Fe, so I could take this job, it took her 2 weeks to get a gig because her skill set is so in need, and she makes good money, right? And she works at an outpatient facility. She's doing well. So those are really the areas that we're focusing on. One of the biggest funding resources that are available for people is the WIOA, Workforce Innovations and Opportunities Act. We get about $25 million in the state of New Mexico that's funneled to 4 regional workforce boards, a northern board, a central board, an eastern board that does the entire eastern half of the state, and a southwest board that goes from Socorro down to Cruces West. And there's 2 main areas of funding for adults that you can use that for. One is for wage subsidies for employers who have training programs. You can pay up to like half someone's salary while they're in a specific training program for a needed job area like the ones I just talked to you about. You can also get what is called individual training accounts. So if I want to go and be a healthcare worker, if I want to go get a job in welding, I can go to my local office and apply for these WIOA funds, and a lot of times get money for training, so tuition, supplies, that sort of thing. And so that's a really important thing for folks to look at. 2 more things I really want to talk about that Amy asked me to talk about: prison reentry. So we dipped our toe in the water on this last fall. We actually had some prisoners from Santa Fe Correctional Facility, the state's correctional facility in Santa Fe. We worked on a skill set for flagging so that people could go work on construction crews. A lot of the contractors that do highways were saying they were having a real hard time finding people to come work on their crews. And so we gave them safety certifications, we gave them training on how to be flaggers, and we actually got them interviews with some of the road contractors that were out there. The results were fairly mixed, and to be honest with you, as we were starting to look at measuring those, the pandemic hit in March. And so we don't have a lot of really good data on how that's worked, but if we want to revisit that once we kind of get through some of the pandemic stuff, we want to do that. I also want to say that we got a grant from about $1.5 million from the federal government for what we call dislocated workers, and that means people that are unemployed. And the Central Workforce Board, one of those boards that I talked to you about, is taking about $250 grand, and they're going to try to target about 50 prisoners who are currently in the county facility, the Bernalillo County facility down there. And the county is going to look to try to hire them to do sanitation and a bunch of other things that they're going to need for the foreseeable future in this COVID environment. And so they're really looking at that as another way for us to really try our hand at this prison reentry program. The last thing that I really want to talk to you about, just so that you know, and this isn't directly related to the job situation that we're talking about, but that the New Mexico Department of Workforce Solutions does oversee the New Mexico Human Rights Bureau. That is the agency in charge of overseeing, like I said, discrimination. And so when people have a claim of discrimination, they file a complaint with the HRB. They get about 80 inquiries a month, or intakes in terms of cases per month. About 30 or 40 of those become filed charges of discrimination. So process around 400 cases per year. We also closed about 35 cases last month. So we're doing actually a pretty good job as of now of keeping up with the cases that are coming in. We had a little bit of a backlog from the Martinez administration. This was not really one of their priorities, but we've done everything we can to try to close that backlog down. The average case with the Human Rights Bureau is under 6 months old, which for state government is actually pretty good. Most people that contact HRB or are in contact with someone in our office within 24 working hours, and with an investigator within a week. About 90%, and this is something interesting as well, of those cases filed with HRB are dual filed with the US EEOC. And so a lot of these are joint cases between us and the federal government. If the EEOC cannot process these cases, sometimes they'll give us money actually to help pay for our investigators to do that. But I just wanted to let you know that we're working on this, and about a quarter of the charges filed with HRB are alleged discrimination based on race, color, or national origin. The rest tend to be gender, religion, sexual orientation, that sort of thing. So Amy, if that's okay, I think that's what you asked me to cover, and I would be happy to kind of answer any questions anybody might have. No, I'm good? Okay.
No, you're not good. Sorry, I was having problems finding the mute button. No, that was wonderful. Thank you so much. That was a really good overview. And so we'll turn it over to the council members. Those of you who are visiting us, we welcome you to ask questions as well. I think I would personally like to know a little bit more about the Human Rights Oversight Board. If you're having 80 cases a month, you said, generally speaking, what are the outcomes of those cases?
So it really depends. Not all of the cases actually make it to a determination. So what a lot of cases, and what that means is that the investigators come to a determination, or they can take it to the Human Rights Commission. But what a lot of people, in fact, probably the majority of cases, what they want is a right of no determination so they can sue in court. And so a lot of lawyers will file these cases and get our okay that, hey, look, there was something there and there's non-determination, so they can bring a case towards district court. A lot of times they just need a letter from us saying there's no determination there, so they can bring it to a district court and let them look at it. So I would say that's a lot. I don't have the exact numbers in front of me, those there, but only about 6.5% of all the cases that reach a determination reach a probable cause determination, which means our investigators said, yeah, there was probably some bad stuff going on there.
Thank you. Do others have questions around workforce development or some of the prison release? It's not prison release. What do you call it?
Rehabilitation or reentry.
Okay, reentry.
Mm-hmm.
Any questions about that?
Secretary McCamley, this is Anjali Taneja, one of the members of the council, and the executive director of Casa de Salud clinic in Albuquerque. I'm curious, thank you, that was a lot in a short amount of time, and it was really effective and concise. And you presented a lot of stats and information. For apprenticeships, I mean, I've heard of national stats showing that over 80% of apprenticeships, at least federal apprenticeships, are filled by men. Do you have any idea why 97% would be the situation in New Mexico? Are there things unique to New Mexico as you've been kind of digging around in this? Or are there things to kind of yeah, I guess, are there background things? And my second part of that question is, do you know if there's like a racial demographic breakdown around apprenticeships?
So I apologize, I do not have a racial demographic breakdown, but I do know that in New Mexico, I think only one registered apprenticeship that we have right now, actually two, are in the traditional construction trades. So electricians and carpenters and sheet metal workers and that sort of thing. And that has been a fairly male dominated industry. In fact, the unions, you know, it's the International Brotherhood of Electric Workers. Once you get past apprenticeship, you're called a journeyman. And we are trying very hard actually to change that language because, you know, it may seem trite, but if I'm a woman, and that's what I see, maybe I don't really feel welcome in that type of environment, even over and above the traditional, hey, there's like all these, dudes in here, that it's a very traditional thing. So I would say other states have done a better job of expanding what apprenticeship is into more non-traditional areas like tax preparation, like some of the educational things that we're talking about, those types of areas. And those are traditionally less dominated and kind of traditionally men's jobs. Now, I will say this, it's the flip side in healthcare. If you look at our nurses, and as I said, that's one of our biggest situations is our lack of registered nurses. 83% of registered nurses in the state of New Mexico are ladies. And so, we need to do a better job overall of just kind of getting rid of some of these gender stereotypes, because not only does it place these artificial ceilings on what you can and can't do, or what you think you can and can't do, but it's really inefficient. I mean, we need people in all these jobs. And if half our population is saying, well, I'm not going to do that because of my gender, then that's just really not going to hack it.
And are there outreach difficulties? I would say that we run an apprenticeship program out of our clinic, and I am not always aware of what the expansiveness, a different kind of apprentice program for healthcare, but
it's not registered apprentice?
No, being interested in this area of work, and we have case management teams and all of that, we don't necessarily, as our team, know a lot about the apprenticeships that are available for folks in New Mexico. So it would be very cool to see perhaps more in the ways that I know you've done a lot of YouTube related things, and the government's trying to do more interactive things, but I wonder how deep the information about this availability of apprenticeship goes beyond the trade unions and other folks who are already connected.
Yeah, and it's a fair question. So we were actually on March 18th, we had a press conference all set up with the governor, where we're going to have this big announcement declaring March Apprenticeship Month. We were, really working with high school guidance counselors, because a lot of times they basically have two things. You're either going into the military or you're going into a bachelor's degree, and they don't really know about apprenticeship programs. I mean, we were really looking to start, doing more advertising on it, things like that. And then the pandemic hit, and we just became the unemployment shop, and we just got overrun with unemployment claims. And we are just now not only sort of getting the resources back to be able to kind of look at these things, but also it was very hard for us to focus on getting people back to work or even into these sorts of programs when you're telling people stay home and stay safe, right? You don't want to have those dual messages, because we had to get control of the virus. I put in my chat my email. If you would like to email me, I'd like to very much talk to you about your apprenticeship program, what you've got, and see if we might be able to get you registered, and see if you might be interested in looking at that program. And I'll tell you, because to get more people interested in registering their non-trade apprenticeship programs, because everybody on our apprenticeship council is pretty much just focused on trade, and we've got to figure out how to expand the pie on that. So I'd love to talk to you about that.
Yeah, I mean, we have a really cool apprenticeship program. It's volunteer or work study, and a good majority of our apprentices have been young folks of color, mostly Latino women, and over 250 graduated from 500-hour apprenticeships in a healthcare clinic, and many go on to become doctors, nurses, PAs, physical therapists, otherwise. And so, for us, we have a very unique position where we are working with the community and bringing in folks who we know are maybe first generation, don't have mentorship capabilities from other folks, are not affluent, are not, have other structural barriers getting into healthcare fields. And, one, we'd be interested in talking with you about that and what the state is doing. But two, I don't know if it was cool to know about the regional workforce boards and what they're kind of looking at doing and what they have funding to do. Would it be possible to get from you or from them some more information on
hell yes.
mandates?
Hell yes.
Are there ways in which our council, our little council, could be helpful in pushing forward? Like, we would like to see more emphasis on whatever, or be available to talk about, or at least help. Is there something statewide that we could help kind of help craft or push to diversify?
Well, what I know in terms of your stuff is that if you had an apprenticeship program, we might actually, and if you've got people, let me reset here. It's important for us that everybody gets paid during an apprenticeship program. So when you're saying volunteer, that wouldn't work for a registered apprenticeship program, because people need to get paid while they're learning whatever they're doing. And there's got to be that set career pathway. So if you're done with it, there's got to be someone willing to hire you on the way out. Mm-hmm. That being said, I don't think that would be too difficult a task for your specific organization, because we need healthcare workers like crazy. I mean, like I said, from nursing assistants all the way up to brain surgeons, we need everybody. And number two, we need to really hook some people up with some of that WIOA money that we've got that can do, that can really say, hey, look, if you're willing to put half of a salary, and even if it's minimum wage, we might be able to match that for an 8 or 9 week period, or however long it goes for, and then help with some of the educational portions of that as well. So that money's there. The central board, the one in Albuquerque, actually does a pretty decent job of getting that out, but some of the other boards have not. I'll be honest with you. There's a lot of money that is not spent, and that's not acceptable. So yeah, I'd be happy to talk. Give me an email when you get a chance. I'm kind of inundated. I'm backlogged already today, but I'm happy to get back to you maybe tomorrow over the weekend. Is that all right?
Yeah, super. And my follow-up question was related more to this council also. Like, we are tasked with helping to hold state institutions accountable and helping to move some policy or administrative or other changes, or ask for mandates, or other recommendations. And so we have already started talking about various different recommendations in different areas, and curious if you have identified areas in which it would be helpful to get some push from, or that could benefit from.
I think the biggest thing in terms of a direct policy is how we could push more of the high school guidance work and towards letting people know that these things are an option. It just hasn't really been in the past. It's been go to college or go to the military. Like, that's pretty much it. And that's not anybody's fault. It just kind of is what it is. And I put up in the chat our new website for our apprenticeship programs. That was one of the things that we had to do. Our old website was pretty garbage. It was just a list of all the programs and one contact email, and that was pretty much it. And on this one, we've actually got specific pages set up for all our registered programs. The other thing that would be useful for us is not pushing state agencies, but pushing employers. That's really where the roadblock is. Employers have to kind of be led to the water to drink to see, hey, look, if you guys put these apprenticeship programs in and you pay workers a little bit while you're training them, yeah, it's a little bit of investment, but not only are you going to get workers that know the specific skill sets for what you're needing, they're going to feel invested in your company because you invested in them, and they're going to know your company culture or your employer culture. It doesn't just have to be companies, right? So the biggest thing for us in terms of pushing isn't really state agencies, it's pushing employers to really adopt this, because employers have to come to the table first, then we look at recruiting. Let me just give you an example. Up at Los Alamos National Labs, there is a contractor called N3B, which is one of the companies doing some of the cleanup operations up there. They started, and they're out of Newport News, and they do a lot of work with the Navy, so they're very familiar with the apprenticeship model. They started this program up, and they said, yeah, we'll work with you, and we got them half of their stuff funding. And I think they hire, 10 or 15 people at a time. They have never had an empty slot. Recruiting, all they had to do was put it on Facebook, and it got boom, word of mouth, because it's like, hey, we're going to pay you, 10, 11, 12 bucks an hour for 10 weeks while you learn how to do stuff, and then you're automatically going to a job where you're paid 25 bucks an hour with health benefits. Not a problem selling that. And so it's getting employers to come to the table to be able to willing to make that investment. That's been our biggest challenge.
Are there ways in which we can help craft wording or push or policy to help incentivize, like especially in healthcare, incentivize hospitals and healthcare, or help push mandate from the state or something? Are there inherent incentives right now for employers?
Well, there's definitely inherent incentives for getting employees in the game because there's such a worker shortage in healthcare. I think there's two things that can be pushed. Number one, to go into some of these employers and say, hey, look, are there other places around the country that do these kind of apprentice type programs for healthcare? And can they be modeled here? And then getting someone to try it. I would also say that, and this is maybe one for Jane, one of the issues we had in terms of the healthcare folks have been getting certified nursing assistants or licensed LPNs, licensed practical nurses, so that the 1 year to go work in long-term healthcare facilities. The problem is the pay is so low that they had trouble attracting people to a really, really tough gig, right? And so figuring out ways of figuring out the pay, same thing for early childhood. For those folks, we were looking to try to get a registered apprenticeship program up in Taos for early childhood. But the problem is you got to get a bunch of employers to kind of come together because you can't run an apprenticeship program for 1 or 2 people. If like the classroom portion is going to be done at a local community college, you need an economy of scales for 10 or 15 people. So getting that together, but also the pay is just, you got to have a pay scale where it shows if you do this, you're going to get more. And that's been really one of the challenges.
I have some questions about the prison reentry work, but I want to see if other folks have thoughts or questions around apprenticeships or otherwise.
Hi, this is Hussein. Sorry I'm late. Actually, I'm in the hospital today and working. Good times.
Hussein, I just want to say that your haircut is extremely sexy, and I'm appreciative that you have also fired it before it quit. I just want to tell you how happy I am and how good looking you are.
I think we see the same barber. So, yeah, he's really good at what he does. I'm curious, Mr. Secretary, if I guess when I'm looking at this from like a policy standpoint, I'm trying to see if there's a way that, I don't know, I don't know if there was some way that the government or that the governor were able to sort of subsidize these apprenticeships in some manner to help close that gap. I'd imagine that would be, I don't know if there's something like that in play or if that's been discussed before.
So you're saying, I'll be real honest with you, the money's there. Like we have this money through this Workforce Innovations and Opportunities Act. The issue has been, frankly, that the organizational structure that is used for getting that money out there is, how to put this nicely, suboptimal.
Okay.
And we were just once again, I mean, we were just really getting going on having a process to examine, could we change up the structure by which these regional workforce boards are set up to have more accountability and more pressure to spend this money in a more efficient and effective manner when COVID hit. So we are going to try to continue to look at that. But there is $25 million out there that can be used to assist with these programs. And I think the question I'd have is, how do we do that better first before we say, let's get money? But we're just starting to kind of get back on the horse a little bit for that process, and working on that. But, you know, pushing for accountability in that regard would be a good thing. I'm not sure if you guys can do anything to help because this is really, it's our job. We kind of oversee that, but we're starting to work with the governor's office. There's a guy named Daniel Schlegel in the office who's been kind of our point person there, and he's been really, really good. But once again, and more of a resource allocation issue, I'll be honest with you. Everybody's been drinking water out of a fire hose, and that hose level is only so big. So that's kind of where we're at.
And I mean, I'm also, and thank you for that. I appreciate it. And once again, I'm sorry I'm late and I missed the large portion of the beginning of your talk. But I'm curious. You know, there's the BA&D program that I feel like is sort of a great structure. I don't know. I have personal bones with it. I don't feel personally that it kind of fit what was originally set out to do. My impression when it first started was that it was to offer sort of a road for people to get into medicine that had the drive to do it, but maybe didn't have the resources or the community support or the family support, so on and so forth. and I mean, this is my personal bias, this might not even be true, but a lot of people that I've seen in the program were people that I felt like, I mean, that I know personally would have been able to do it anyway, right? Their family had resources, so on and so forth. They were just happened to be smarter. I'm curious if there's other programs that are maybe that are being made for specific tracks, like you just talked about nursing, but like PA, PT, like specifically for that, starting in high school.
Yeah, so let me say two things. First of all, I appreciate the question. There used to be LPN classes in a lot of high schools around the state, and I don't even know if there's any left. And I know that Santa Fe, I think it was Capitol High. It was one of the two high schools in Santa Fe was actually working with Christa St. Vincent Hospital up there on one of those pathway programs. And it's the first one that's been out there for a while. I'll be honest with you, and I apologize. I don't know where that is. We were just looking at that before the pandemic hit. But we should probably check up on that, and that'd be one good thing. The other thing is, I got to tell you, it's not rocket science that is one of the big barriers to getting more nurses. It's we don't pay nursing instructors enough. And because of that, it's really hard to recruit people at the community college level that can teach those courses. Because if I'm going to get paid, 50, 60 grand to be a teacher, and I can go make half again as much being a nurse, I'm probably going to choose option B. And so finding the funds to be able to pay for nursing instructors is one of the hugest barriers we have to increasing the amount of slots that are open at community colleges and getting more people in there. The other big barrier at the nursing level, and I don't know as much about the doctor level, so that'd be something you'd be probably more familiar with than me, but at the nursing level is that there's not a lot of clinical sites. And sometimes we've had issues with colleges being able to find appropriate clinical sites to place nurses in. Some of that is because, I'll be honest with you, I don't think there's been a lot of creativity used in the past in terms of looking at school clinics, looking at outpatient facilities. It's kind of, here's the places we've always been, and we haven't been doing that. So we're kind of wanting to work with the nursing board to try to figure out new ways of doing that. But those are the two big roadblocks that we found in terms of nurses. I know in terms of docs, and you probably know this better than me, but I've heard one of the big issues with getting general practice docs is that most people, if they go to med school, want to go into specialty because that's where the prestige and the money is. When I think one of the biggest, and I may be wrong on that, but I know one of the biggest problems is we don't have a general practice doc. My sister just went through med school at Emory out in Georgia. And she turned down a bunch of money to take a job with the VA because she's a damn do-gooder. But she was telling me almost everyone she went to school with wanted to go and be a specialty doc. And she's like, no, I want to help people at this level. I know I'm not going to make as much, but it's important. So I don't know how you have asked people going or being more the family practice folks, but I know that's really needed.
Okay, thank you. Appreciate it.
Thank you.
And I think Dr. Patel would be able to definitely say better than I would.
Sure.
So,
yeah. Hello. Yeah, I did have a follow-up question on that. Hi, I'm Darshan Patel. I'm a third-year family medicine resident at UNM.
All right.
And sorry, I'm in clinic. So, but I had a follow-up question on that. I think UNM is a little bit unique. UNM, at least the medical school, does produce a disproportionately high number of people going into primary care, specifically in family medicine, which is more people tend to actually do primary care through that field than internal medicine, peds, and OB. But I guess my question is specifically to nursing. I think, we have state programs through NMSU, through some of the community colleges, and through UNM. One of the issues that we're facing here is that even though, I guess there is a lack of diversity in the schools, in the people teaching and learning in the schools, but also there's a proliferation of private organizations that are training people to be in nursing that it's much more expensive, and people are saddled with debt and not necessarily getting jobs that pay them back. And so I'm wondering, how do we create a state like public funded training process that it seems like there seems like a limited capacity perhaps at UNM, NMSU, the community colleges. How do we expand access, and how do we ensure that the trainees in all the health professions, not just medicine, but in nursing and others, reflect the populations that they serve? Because I think that's one of the barriers that I see. People are interested, but they can't get, I mean, I see that in my clinic. You know, there are people who are trying to advance in their careers. They're already in healthcare, but they want to get into from LPN to nursing, or from being an MA to an RN, but they don't have access to the same education, or they don't have the ability to, you know, use some of the, like, they're just not creativity in the way that maybe some other institutions around the country are doing. I think Georgia State is a recent example of how, you know, institutions are kind of meeting the needs of the student, the learner. And I think in that way, we can actually prop up more of the lower income and diverse students in our state. Because right now, at least in the College of Nursing at UNM, it's just not a diverse, in terms of racially diverse group of students in comparison to what we see in the workforce and the need in our state.
So Doc, let me just say, that's more probably a question for the higher education folks. I don't know that area specifically, but I will go back to the two things I said earlier. If we're gonna have more slots available at our public institutions, so you don't have to just go to Pima, if you know what I'm saying, or Grand Canyon, and pay however much more in tuition you're gonna pay and end up with all that debt. We've gotta have more instructors and more clinical facilities. And we've gotta find the ability to be more creative in our clinical placements, and we have more instructors, because from what I understand, there are national accreditation requirements that to have a certain amount of people in a class, you got, I think it's like 1 to 12 or something. I don't remember exactly what the numbers are, but if you only have X amount of instructors, it really limits the amount of students you can have in your class. So that one I do know is one of the big issues in terms of opening up more slots at the community college and the bachelor's levels for nurses. In terms of the diversity of faculty, I don't address that. I'm sorry. That's not something that I feel comfortable or have any kind of expertise on.
Can I speak on that a little bit? I'm curious about, I mean, because thank you for making that point, Dr. Patel. I appreciate it. While I think creating more slots would ultimately be good for New Mexico, right? More nurses. I don't know if that would improve the diversity or the inclusion amongst the people who are being sort of admitted. I know that their current admission process, and this may have changed since the last time I heard. I know my nephew had applied some time ago, where they had removed interviews, and it was pretty much based all off of your, I forget the name of the admission exam, but it was based off of your admission exam and I don't know, some other factors, your GPA or whatever. And that right there probably doesn't take into account all the things that need to be considered in order to sort of fill, I don't know, the to put enough diversity into nursing, right? So I know that the American College of Physicians recommends for admission processes to be sort of a holistic view, where, you know, not only considering grades, but also considering their volunteer work, their background, and what the field needs, right? So if we need more diversity, then that's something that maybe should be weighed in the admission process. And, you know, the ACP came right out and said that is something that should be done to improve diversity in medicine. I'm wondering if that's something that we could look at as far as not only how they're recruiting, but also their admission process.
Hussein, I didn't mean to interrupt. I've actually got to go. I've got to make some calls before 5 o'clock to deal with some issues I've got that the Lieutenant Governor asked me about right before I got on this call. So I'm very sorry about that. But I think that would be a really good discussion point to have with the higher education folks. I'm sorry, I don't have any direct say about that, but maybe the new person who's working with higher education, Stephanie, might be able to help, as well as it might be good for have some of this board, have some of the presidents or healthcare deans from some of the universities come and talk to you.
All right, awesome. Hey, thank you.
And Amy, I'm sorry, but I really got to make this call before 5 to get some stuff taken care of. But like I said, my email is in the chat for anybody, as well as the apprenticeship website. If you guys have any questions, I'm all ears.
Thanks so much. Appreciate your time.
Yes, Secretary.
Thanks, y'all.
That guy really does have a cool haircut. I mean, gosh, I don't know how you came up with that style. Nice.
I'm not sure. Not sure that was on the agenda there, Hussein. But thank you. Kaylee, can you tell me what's next on the agenda?
Yeah. So we had the question and comments, and then now I think, well, since we lack our expert, we are moving on to the communications agreement for the group.
Yes. Okay. So what we want to do is a couple of different things about communication. One of those is, you know, the main council is recording their meetings and posting them to the YouTube. And we just want to see what the subcommittee thinks about that as well. I do know that I started off this meeting asking people if it was okay if I recorded, and I got a thumbs up from those of you who were present. But we would like to kind of have a bigger discussion about, do you want the meetings on a regular basis to be recorded and placed on the channel?
I mean, I'm totally cool with that. I don't have any problems with it.
I assumed that the meetings would be open to the public in terms of viewing, so don't have any issues to recording.
Okay, sounds good. Everyone else is a visitor, so you guys, it's not your meeting to discuss. So thank you. I think we'll go ahead and do that. We will be able to record those, and sorry, someone just knocked on my door. We'll be able to record those and move on. The other thing in communication that we really wanted to have conversations about is how we send out information to each other. I know there's been some conversation around it being very difficult for people when they're getting too many emails that have information coming. And so we wanted to talk with you all about what would be the easier way for that information to come to you. And also, generally speaking, what kind of information do you think it's okay for us to be sending out to each other, right?
Was Google Docs a no-go?
I'm sorry, say that again?
Was Google Docs a no-go? Because I remember us talking about possibly using Google Docs, but there may have been some issue with it from the state side.
Yeah, I mean, we just don't want to create a folder that puts information out there that as it's coming from the council, right? Because then anyone who ends up with access to that folder would be able to, I don't know, think that they were getting official information from the council, and it's not official information. So we don't want to have that kind of shared folder. Yeah, so no, that's a no-go.
Okay. I mean, I guess email in the same email text or chain, I don't know. I understand that can certainly be cumbersome. So my hope would be is that we would keep it to, you know, specified or, you know, very strictly specified information as opposed to, you know, also the Zoom links or also whatever else. Otherwise it can get very confusing. What do you think, Angela? What do you think? I don't know. I think you're muted.
Sorry, I was muted. How is the larger council communicating with each other? They have a lot more people than we do.
So what the council agreed to is that any information would be sent to me 5 days before the meeting, and then I will make sure to compile it all and send it out the Monday before the meeting. I think there's been some conversation as well about, you know, some information that goes out is information that might be better suited for a listserv or something like that, or, you know, a newsletter if you were to join that. And so The council did not decide this, but some of the other subcommittees had these conversations around it being more important to make sure that what's getting sent out to the council is reports, very specific information about the council activities, minutes, that kind of thing, rather than things like articles that you, ran across, or blogs that you thought were interesting and connected to our mission or our purpose.
I guess I have a hard time. I feel like it makes sense to have at least some sort of shared workstation or workplace. Like, for example, this is my first, I guess this was an open invite to this subcommittee. Though it makes sense, as a physician that who's on the main group to be part of this subcommittee. I feel like what I can contribute would be here, and so maybe we have a space that's closed, like a locked or like a password protected, I don't know, like not a publicly shared Google Drive, where we have meeting minutes, where we together have I think we need to have some sort of shared space that's not going through every time through you, Amy, or whomever, just to collaborate, unless there's been another way of doing that. And so I wonder how other government functions work where you guys are working together. Can we just use it separately? Because I think in any organizing work, especially when we're super busy, we're going to need to have more efficient communications if we want to be productive.
No, and I think, right, so in other government work that we are all employees of the state, and so we can use things that the department has, right? So things like SharePoint or Microsoft Teams or things like that you have to have special permission to get into, where with the council that everyone is not a state employee and doesn't have can't be invited to those things, then what that means is that we would be using something that's free that doesn't have the ability to do that, right? That it would be really easy for anyone to just share a link to the Google box, and then all of a sudden everyone has access to that. So that we just don't have access to the kind of shared way of doing things that has the security that we would need.
So I just wonder kind of practically, how, for example, were there meeting minutes from last meeting, and how is that to be shared to, will that be posted somewhere? Is the entire council going to get that? And let's say Hussein Anjali and others want to collaborate on a document. What if we just create a Google document, and put our ideas down? I just find it really hard to imagine, just how we're going to do work. Let's say we want to look, or is it just going to be in these meetings? We're going to have to meet separately and create things that are separate from these meetings, right?
Yeah, is it, Amy, would it be possible if maybe I'm really slow today, the council members can have a listserv or something offsite off of the state related things and be able to communicate there and create informal shared documents otherwise there, and also invite folks from the state, all of you, to it if we want to be in conversation. That way it's not housed, there's not a lot that would necessarily be going on, but just a place to organize our thoughts and otherwise. Right now it's been helpful that we can send emails back and forth to each other and have some of the informal conversation, and then to get the formal reports from you or Kaylee before the 5 days before the meetings. But I'm on another kind of advisory board, and we're dealing with some of the same kind of structural issues with the county. We don't want to create something within the county that is then open to anybody or is too informal or has people from outside the county, but it has slowed us down in our ability to just kind of more informally communicate. So it almost seems like a offsite listserv that is not formally the council, but has the folks on it, could maybe have some of that back and forth. And then we have formal things going through state folks. Like I will just give an example. Jane sent out an article from Health Affairs that was so cool to read. And it was so helpful to get that kind of in a more informal setting between the meetings, and communication about, are we, let's make sure that at least one of us is on the larger council meeting, other things like that. There's space for more spontaneous conversation, while also knowing that our email boxes are filled up with things related to other work. So is it possible, and have you seen this happen, where maybe there's an informal kind of email mechanism or otherwise that we invite the state folks to for stuff that's not part of the record perhaps, but will help us do better at the job of, so that those two ways, the emails to you all for sending out to the group, but then something informal that we could maybe invite you all to?
I mean, I don't know that anyone from the state would want to dictate if you do or do not do something like that.
Okay, well, maybe that's a solution. Then we can create something, and we would want to invite all of you to it because that has been so important for our conversations. But to continue to follow the process that you've set forward and send out reports, other thoughts and ideas to you all for sending out to the council.
I mean, again, I don't, go ahead.
Oh, no, please go ahead. I was gonna say, what's your WhatsApp? I mean, like a WhatsApp thread. Like, I don't know if, is that sort of just informally discussing things, but not really going, forwarding documents. Is that what I'm hearing?
Is WhatsApp like Signal?
Yeah.
Okay. I mean, yeah. I mean, I think there are other state agencies and task force and things like that use Signal. So I think that would be okay. But it's the documents that would be a problem.
Yeah, because, I mean, or even a listserv where we can just send one email to one email address and it'll go out to a group of us, but is not hosted at the state, so it doesn't have to have issues with concerns about it getting, whatever the concerns that are real that are brought up, but that we can still kind of be email. I'd rather not do WhatsApp. It's too cumbersome for me to be on a phone and trying to do things, but to be able to do something on a computer that doesn't disrupt or cause privacy issues with the state. That, I mean, it could even be a Google group that we invite state folks to, that we invite everyone on this team to.
Yeah, and I think that's fine. The only thing is that it cannot have any documents on it that are council documents, right? So you can't store minutes there. You can't you can't work on a project together on there because, at that point if that document goes somewhere else, then all of a sudden it becomes, well, this is what the council said, when that's not what the council said, right? But I think, again, we wouldn't dictate the creation of something like that makes communication easier.
Okay, and then the minutes for this subcommittee and other subcommittees, are they stored somewhere centrally that folks would have access to?
So really, we've only had conversations about the minutes for subcommittees being sent out to other subcommittee members, right? And so the subcommittees have agreed to do minutes, and so we send those out. Well, Kaylee sends those out to you all. We haven't. What we're going to share with the council is the meeting report, right? So Kaylee will join the meeting and give a short overview of what we went through. And if there are suggestions and things like that, we'll send that up in a written report format. But we're not giving the council the minutes.
Okay. And speaking of the larger council, I was on the last council meeting and I I don't know if any of us otherwise were on there. I know Kaylee was on and was giving some awesome live reports out to the Health Council Subcommittee, which is so appreciate. But are we in the future going to be doing report outs outside of that, or will you continue to represent the council, Kaylee?
So we will regularly have space in the council agenda for Kaylee to give a very short report out, right? Like we only gave each of them, I think, 3 or maybe 5 minutes, not very much time. But when it comes to us making suggestions and sending things up, then what we can do is put space in the council agenda for more, right? So for instance, if you all decide that you want to make some suggestions around what we just heard from Secretary McCamley, if you want to suggest that in a bill format or a rule format or anything like that, that's probably going to be something that's more of a written report that we then send up. And probably we would put time in the agenda for more discussion on that, because I imagine if you send a suggestion up that the council's going to have some questions. So as we get to the point where we're sending suggestions forward, that's stuff that needs to go into the agenda at a larger, more time, not larger, but more time.
Great, that's really helpful. Thank you so much.
Sure, yeah.
Thank you. And how are we, I guess what was unclear to me is when we were sort of coming to those conclusions. I didn't know whether it was going to be sort of top down, you know, the main committee saying we think this is important from a healthcare perspective, and to sort of hash out some of the details, we want the subcommittee to look at this. Or if we were thinking there's things that I feel like are very important and the committee would agree, we would write some kind of policy brief and send that up to them. Or I'd imagine it's going both ways. I just don't know which is happening first and how I should be sort of directing my research time, so on and so forth.
So it should be going up and down and side to side, right? So, right, it's all the different ways that we can.
Like a 6'4" Impala?
We are on that what?
Like a 6'4" Impala? I'm sorry, just a Snoop Dogg line.
Yeah, exactly like that, right? So that, you know, we're on a time crunch, and so we don't want to stop anyone's progress. And so what we should be doing, and which is why Kaylee and Shawnee and Tammy and I are having a lot of communication with each other as well, is that what we want to do is, you know, in the reports last week, we heard from Kaylee and Shawnee and Tammy sharing what you all had talked about. And several of the council members either private messaged us or sent us emails later, or they joined the meetings because they wanted the subcommittees to take a closer look at something, right? So some of the things that the main council has said that they'd like the health committee to look at is paid sick leave is one of the things that they would be interested in you looking at. That was a private message to Kaylee. I think one of the other, Kaylee, remind me, what were the other private messages to
There
you?
was one about the Lovelace incident with the hospital separating the Native women from their babies based on profiling and using zip codes instead of what they're supposed to do. So that was something I think Jane said she reached out to somebody at DOH because the governor did conduct an investigation. So I think that's something that we could definitely get someone on or to share with the group what that report found, and I think that's what we need to follow up on with the group if that's what you guys want to hear, and we can have Jane invite that person for the next meeting maybe. Let me pull up the rest of it. I know it's here somewhere.
Okay, so that, right, that's the main committee basically asking us to dig in deeper, but then at the same time we can send up suggestions to the main committee. And then the other thing is that we want to make sure that the other subcommittees, if we're co-working on things, that we're communicating across the subcommittees as well. So for example, today in the Public Safety and Law Enforcement Committee, they had a lot of stuff on their priority list around private prisons, which you all also mentioned quite a bit last time. So what we'll do is we'll actually schedule one of the subcommittee meetings to have Secretary Lucero come and speak with both committees at the same time, so that you all can be asking questions around the healthcare in private prisons, those questions you wanted to get answered, and then they'll also be asking the questions that they wanted to know. And then that way we're working together on the same topic. So there's no time limits whatsoever. Whenever you guys are ready to send stuff up, we'll go ahead and do that. And they are already sending stuff down, so.
So with that being said, I mean, should we be, I mean, because we already know that paid sick leave was one that we were, I mean, I think that was on a couple of our lists when we sat down and did that. I think that seems to be important to the main committee. I know there were other things that we talked about in regards to substance use in medication assisted treatment in prisons, as well as needle exchange. There was a lot of stuff we were talking about. Should we be focusing some of that on our time in between in a coordinated effort, I suppose, in between meetings? Would that be?
I'm curious as to, like, do we have, I wasn't here at the last meeting, so I'm not sure. And I know basically at the main meetings, it's been kind of people sharing like lots of ideas that, around so many different kind of issues. Has there been a process in this subcommittee right now of like identifying priorities, or are we still at the kind of, this is the whole list of possible issues that we could potentially address?
Both the subcommittees and the main council have done the brainstorming stage, right? So that all the ideas have been thrown out. It doesn't mean they're all the ideas at all. Still, further ideas can be thrown out, but we already have enough from the meeting so far that we're going to start doing the work. And so for us, Shawnee, Kaylee, Tammy, and I, what we're doing is we're looking at all of the priorities that folks have listed already, and we're starting to invite people to speak on those issues, right? And so at each of the meetings, what we're moving towards is you all gathering information. If you want to gather additional information outside of the meetings, I think that's amazing. And those are the communications that you can send to Kaylee, and then she can make sure that information gets out at the same time that we send the agenda out, so it's coming in one email, right? And so at this point, what we're really starting to do is gather up information that can inform your suggestions and inform what you say we need to move forward for you all to the council, and for the council to the governor. So I think today we heard from Secretary McCamley. He's given us some information. If that starts to generate suggestions for you, we can start putting something together for that. If it's something that you say, okay, he didn't answer these questions for me, then let us know that, and then we can find the person who can, or the report who can answer those questions. You guys had a really, really good list last meeting, and so we already have a very good list of things that we need to be looking at. So we're looking at inviting Secretary Lucero from the private prisons, inviting the Department of Health to look at some of their data, to look at, to ask the Medicaid Bureau or the MAD Bureau to come, to look at the Substance Abuse Bureau also to come, right? Like you guys already gave us a lot of stuff. So we're already looking into the reports, and we're looking into the people that should be invited to these meetings. The council is a little less structured in that information thus far.
Yeah, and so from what I recall from last time, we didn't prioritize anything. We just sort of put things into like buckets that we were sort of like, there were things that were brought up about UNM, right? So that it's, we're the safety net hospital. There's a huge segment of the population who don't meet criteria for Medicaid, and they are, maybe they make a little bit too much money or to qualify, but they're 22 and they have a serious illness, or maybe for whatever reason, they don't qualify for Medicaid, and UNM Cares has been, I mean, I don't want to say gutted, but it's not what it used to be. And so one of the questions is should UNM bring that back, or should that be more beefed up, and how would that look? Talked about transparency from UNM, just other things. So we put it into like a UNM bucket. We had questions about the 1115 waivers and how those are allocated through Medicaid. So I think we talked about, so we had different buckets as opposed to prioritizing things, just because there's still a lot of information, a lot of questions out. And all of these things are important. We just, we wanted to see what the main committee thought, and also to kind of hash some of these things out, because not only was it what's important, but also we're looking at long-term and short-term goals, what was to be likely achieved this session versus subsequent sessions down the road, was my understanding of it. So what we went after with the full head of steam really depended on those two factors. So it was a very long-winded way of me saying that we haven't prioritized anything, just sort of categorized them. Are we able to, can we send him the would that be okay if we send Dr. Patel the minutes from the last meeting? I don't know if that's, I'd imagine it'd be okay.
I mean, I think that's where we're at on the communications agreements, right? Is what, how exactly do you guys want to share out that information? If we're going to send Dr. Patel that information, then we're going to send it out to the whole council, right? And so then what that means is that not because just right, like that would be the agreement that we're making. And so
I guess one thing, I was going to say, I don't know what I don't know how to be helpful without knowing what's going on. And I mean, the last meeting, I guess, was just the subcommittee, but I think, there's so much talent also in the main committee that I think, like, is there a reason to not share it? Because I mean, basically things are recorded. I mean, it kind of helps things along to just put everything down anyway and make it public. Like, this is all going to be on YouTube.
I mean, I don't exactly, right? The meetings are going on YouTube. We've made that agreement. That's kind of how the main committee, if they want to stay engaged and involved, can do that. I don't think that there's anything wrong with sharing the information. I think what happens, though, is that the subcommittee was not created to be a place for the main committee to come and do work. The subcommittee does work, right? And so the subcommittees are small for a very specific reason, right? It means that people can, in a very close and coordinated way, have some very intense conversations that can't happen when you have 25 people in a in-person room, much less a virtual room, right? And so that when we start doing these things like, well, let's invite people and make sure that all 25 people come, or hope to get all 25 people to come, what you've done is you've now increased the conversation in exact that we did not want to do, right? We wanted to have small groups having those small conversations. And so in sharing the minutes and in sharing the information and in sharing all of that, you've basically tripled the workload of everyone because, right, like there's 3 subcommittees, and so if a person on the council says, this information is one that I'm very, very interested in, and so I want to come to the subcommittee that day and engage in the conversation, that seems feasible. It doesn't seem feasible to me, but again, it's not my, I don't have I'm not vetoing anything. It just seems like you're creating a space where that conversation that's supposed to be small and easy, you've now growing it. At the same time that we're having conversations in the council about not having enough time to read things. So that's, like I'm saying, there's not a problem with sharing it. I'm just saying there's reasoning to not share it.
Yeah, so I think we set the norms at this meeting now that these meetings would be recorded and they'll be available and accessible to folks who want to access them or to be in, or from the larger council to join these meetings. I think that makes sense. And the last meeting was, it was not informal, it was a brainstorming session. So there's, a lot of things that are just very much idea form. And I think that going forward that these are recorded, that makes sense as our way for folks from the larger council to want to be involved in some of these discussions, and we can go from there. And we'll be discussing those ideas as we go forward here too.
So let me be clear on what we decided, right? So if you all want to create a listserv, that's something that you will do off the side, but we will, as far as what Kaylee will send out and what we're asking you all to send out, if you have stuff to send out, is to send it to Kaylee and she'll make sure that it goes out in one email per meeting that includes anything that you all want to send out, if it's like very specific to the work that we're doing, along with the agenda and minutes, right? So that's one communication agreement that we've had. And then second communication agreement that we've had is we will post these meetings to the public YouTube channel that main council and public can access. And then I think the third thing that we wanted to talk about was in making those suggestions, how did you all really want to make those suggestions? Because again, right, it'll be conversation that you all have and you will come to an agreement and you can send that up, and that, even as small groups, consensus can be difficult, but then also majority wins can be difficult for people to accept. So we want to come to an agreement on how we want to make those decisions for what does move forward as a priority and a suggestion. Do we want to do consensus? Do we want to do majority rules? What feels good to people?
Gosh, I think coming to consensus is tough for really a group of any size. I think there would probably have to be multiple mechanisms that if there is like a majority rules, then we try to reconcile people who are voting no for some reason. I don't know if a great way of approaching that. If anyone else has any ideas I think that would sound good.
I think we're a small enough group. I think we're 5 people, that like a modified consensus where we try to go by consensus. And if we have disagreements, then those folks, give their input and we try to get to a place of agreement about that. I think otherwise majority becomes hard. And then you have in a 5-person council. So, I'd like to try some form of modified consensus. Amy, I don't know if we need to have the details of that navigated out, or if we can try and see what that looks like among the folks that are present at each meeting.
I think we can navigate it out once it becomes a problem, right? Cross that bridge when we get to it.
Yeah.
With a small group like this, we'll probably be able to do that. But maybe I think what we might want to do is, for any topics that we do think might be very controversial, set a time limit on it or something like that, right? And so navigating through consensus until we feel like this is the time limit we've met.
That sounds good. Yeah.
Awesome. Great. Okay, we've got our Oh, go ahead, Jane.
I just had a comment and a question. The comment is that as you and Kaylee look through the lists of topics and anything health related, and you want to reach out to departments, to agencies, that's part of why I'm here, to offer to help and who might be the right person. And I've worked on a number of these issues. Second thing is really a question, Amy, on the timing. You said that there's time limit is there with respect to recommendations for the legislative session?
I'm sorry, my dog just went crazy and I can't hear anything right now. I'm so sorry. I'll be right back, right?
My dog just reacted to yours.
Okay, I'm sorry. I can hear now. What was the question?
The question was, is there a time limit for, my dog is responding to yours, a time limit for making a recommendation from this subcommittee up to the full council with respect to legislative session?
Yeah, so I think what we want to make sure that we're doing is that as this subcommittee comes to ideas around suggestions that should be moved forward, that we should just move them forward, right? And so the council is going to have, right, like the council's deadline is the legislative session, right? We have to have all short-term stuff up there. We're already running behind just in the sense that most of the other state legislative priorities were sent to, what is Victor, Senior Policy Advisor? Were sent to the Senior Policy Advisor in August. So the council really, the council really should be moving things forward. So if we've got it and we're ready to go, we should send it on up so that they can discuss it. But generally speaking, we want to be moving things forward in this legislative session. So our deadline is January 19th, right?
Actually,
but you need to move forward before that.
It will be earlier than that if there's really a recommendation. So and maybe Victor can help with that. And especially if this has to go up to the full council for action too.
Yeah.
I was going to ask, what's the process for sending it forward? Are we doing it like as a policy brief, like as far as like stating what the problem is and then a literature review and, you know, what our recommendations are based off of the literature? Are we doing it like that, or is it just like, hey, we want to do paid sick leave? It sounds good. You know what I mean? But I'm curious. Like, is there a formal process for this that we should be adhering to, or you know, I should be familiarizing myself with more other than just a policy brief, which I've been sort of familiarizing myself with?
So it's probably for the subcommittee, it's somewhere in between those two, right? Is that you got to have way more than, hey, I want to do paid sick leave, right? You got to have some reasoning behind it. We want to talk about who we have had conversations with, what we feel like was left out of those conversations. You know, we want to make sure that we're sending up enough information for them to really be able to, you know, have robust conversation about it. And then at the council level, it will probably be, you know, that's where we'll get into things like policy briefs and have conversations with Victor about what information does he absolutely need in order for us to be able to send it up to him. I don't think we need to do like full-on policy briefs here, but definitely we need to be able to say, these are the people we talked to, these are the reports we talked to, and, or not talked to, but these are the reports that we read and had conversations about. And here, you know, I think we're definitely going to want to talk about in a session where we're having a huge budget crunch, you know, what do we think the fiscal impact is going to be around this, right? So we might want to ask those questions as well. But also remember, Jane has mentioned this many times, is that it doesn't necessarily have to be legislation, right? Mm-hmm. Is that there can be some suggestions that we might just want to give, right? You know, for example, Secretary McCamley just said that there's money out there for workforce development and it's not getting spent, right? So we might want to do some sort of push or suggestion. You know, we could maybe invite Daniel Schlegel, I don't know how to say it. Schlegel. Thank you. you know, to come and speak with us about what he's working on already, or we might want to say, well, you know, they're already working with the governor's office. It doesn't really need for us to, you know, do anything other than say, we really support the fact that you're working on this, right? So we, you know, we want to make sure that those are options as well, that we don't leave those things off the table.
Okay, perfect. And I mean, I think part of it is I don't have a full understanding of sort of the reach of that. So when I was thinking of how, you know, how changing admission approach could improve the diversity in nursing and physical therapy and whatever else, I don't know what power we would have to sort of help administer that change. So I mean, if I did run into something like that, I guess we talk about it as a group, but what are your thoughts about that?
I mean, I think that we have to stay in the scope of what we can influence. And I don't know, Jane, if you can help us with this a little bit, because there were a lot of ideas that came out in the last meeting around UNM, but UNM is not a state agency. While it does receive a lot of state funding, I don't know that it is in the scope of our influence, especially things like that.
They're governed by, you know, a group of regents, and so that's, you know, the governor appoints and, you know, nominates, and then the Senate confirms regents at these different institutions. But administratively, it would be very difficult, I think, to have much of an impact. I mean, starting discussions with higher ed in general about these issues is something we could help facilitate through the higher education department, for example, or, you know, even legislation is complicated because of the Supreme Court and some of the rulings it's had over, you know, recent years. And so I think for this group, it will be easier. And, you know, I think that is a bucket of issues that have come up. But I'd suggest to focus on those things that might lead to legislative recommendations for this coming session, as well as things that the executive itself could do and change, you know, more quickly.
All right, fair. Thank you. That's really helpful. I appreciate that. Just because I'm like, gosh, it's all this stuff, but I don't know how powerful a suggestion would be if there's, you know, we have minimal control over it other than just making a suggestion, you know. So thank you.
Great. Kaylee, what's next on our agenda?
Well, that flows in with kind of what we're just discussing. So creating those short-term and long-term goals based off the buckets that we identified last meeting.
Yeah.
So
this subcommittee, go ahead.
I was going to just kind of get into what those were. The racial justice impact assessments. I think that's something we move up to the main council. Was everybody in agreement with that? Because I think it's something that everyone has been talking about in the subgroup.
Each of the subcommittees and the main council has mentioned the racial impact assessment, so it feels right to go ahead and put it straight to the council if others are in agreement.
Those are, just to be clear, racial justice impact assessments of state agencies? So
what the suggestion was is that all legislation have a racial impact assessment attached to it. So similar to legislation that would have a health impact assessment or a fiscal impact assessment, so that there are other, I don't know any other states that have done it, but I know Seattle as a city has done it, of attaching racial impact assessments to all legislation. So that's a suggestion that has been moved forward.
Just a practical issue on that, Amy, and this is really more for discussions. I think Caroline isn't on. Just so this group knows, during the legislative session, the Legislative Finance Committee, the LFC, asks departments, sends every bill out to multiple agencies, departments, universities, the Attorney General, really gives them about 24 to 48 hours to write what they call a fiscal impact report, which often does include other things. But I have to tell you, it is very rapid, very kind of intensive, and there are hundreds and hundreds of bills in a 60-day session. And so as you all think about this, I think the concept of it is really important, but having some guidelines, parameters of what it could look like, that it would be high quality and could be done, and that the departments would have some possibility of kind of planning, even if they don't know what any given bill that's dropped is going to say. So it just understand in real time the way our legislative system works. It is very rapid turnaround for agencies to do that. I don't know if there's the possibility, Amy, of an entity sort of tasked with that, or whether it would be integrated into what agencies would be asked to do, but it's been on my mind to raise it, so I'll raise it here.
I think that's great, and I think those are the conversations that we really want to have, right? Because we also don't want to send up any legislation that's going to be killed right away, right? So, or that we're going to pass legislation and then it's not going to be looked at as no one's going to do it, right? They're not going to be held accountable to it. So we will definitely raise those questions and think about inviting, I don't know, who could we invite to the council to really speak to that? Would that be an LFC staffer, or?
I recommend that you talk to Victor Reyes about this because he is the legislative director for the governor, and this is the governor's Racial Justice Advisory Council. So I would talk to him about his thoughts on it.
I mean, I think
sounds good.
It was my impression that, because I think both weeks that that I've attended the main meeting, that was something that kind of floated to the top. And I am aware that other states do that, but I'm uncertain exactly how that is formalized into the process. So, it might be worth looking at how other states do it. I'm wondering if that information would be published or not. I don't know. If not, sorry, go ahead, Jane.
Yeah, there's some more. I Googled it during the first advisory council when it first came up. There are models for it. There are different organizations that have put things out, but when I looked at them, I really did think that we might need some more specific guidance to avoid it just being a throwaway kind of thing. And
we should look at this kind of, Okay.
Or if this will be all helpful, to racial minorities or something like that. And how do you do it in a way that has some rigor to it?
Yeah.
And maybe even, and how do you do it on everything, or could you, remember from an executive standpoint, there could be an opportunity to model it this year voluntarily, right? I think that our department need expertise and help. And if we're talking about health, I will tell you the Department of Health has had quite a year, and it is really, it is a challenging time for many agencies because of COVID, but especially in the health sector, it's real.
Well, and Margaret sent out a report. I think she either put it in the chat box last time we had our subcommittee meeting. Kaylee, I don't know if you have that, but that's something that we can send out again, so that, it highlighted some of the other states and what they had done. But I think right when we ask those questions, we also want to ask, do those states have a 60-day session, or are they, year-round legislatures? So Kaylee, what else was on our, that we want to look at?
So we have the permanent land grant fund use for early childhood education, and that that garnered a lot of support too at the main council. So I think we take that up there and have them have a discussion about it. And it comes up every year according to Margaret and the legislation. So I think it's a good thing to move up to the main council. Our other big bucket was like issues specific to addiction and treatment. So that kind of had I think the 1115 waivers, treatment for Hep C people that are incarcerated, sobering centers around the state, all kinds. There's actually a big list. I don't know if you guys want me to read it all out, but I can.
No, I think, right, you sent that out in the minutes, and I really appreciate how you organized that. That was amazing. But I think the conversation we want to have today is, do we want to invite, Jane, I'm thinking Neil Bowen would be the person to invite to come and speak about all that addiction stuff and treatment.
And he may want to bring a couple of his staff. So there's a group that's been working with the county detention facilities on kind of behavioral health issues generally, and partnering kind of and providing some technical assistance. We are partnering with the Pew Charitable Trusts on addressing substance use disorders, and they have some real expertise. They work with Johns Hopkins University, and Johns Hopkins is able to provide technical assistance and support to us. And so I think what I'd like to do, if it's okay with this group, is to talk to Neil and you and Kaylee and think about how we could put together how to address that bucket. I think I may have mentioned that we worked hard with the Corrections Department in partnership with the Department of Health to get a special status called 340B pricing for medications for pharmacists, for prescriptions within our state prisons, to enable it to be less expensive to get Hep C drugs to treat inmates. And that is a huge issue. So the Corrections Department has a multi-year plan and got supplemental funding to address Hep C. And that is happening and just started this fiscal year. So there's a lot of different issues that have come up, and different people within the administration probably have pieces of real expertise on it, and maybe we could just put together a little panel or group to come to one of these meetings. And we could maybe do the same on Medicaid at some point too, the 1115 waiver and other issues.
So I think the question is, how do we want to prioritize having those visitors? Of course, knowing we got to work with their schedule as well, but do we want to hear from substance abuse first and behavioral health services division? Do we want to hear from the Department of Corrections first? Do we want to hear from, I think we also had on there the Medicaid, it's not Medicaid, the Medical Assistance Division or Medical Assistance Bureau. And then also we wanted to hear from the Office of the Superintendent of Insurance. And what we can do is we can just put all four of them on the table and see when their schedule allows them to come, or you all can set priorities so that we can see, okay, which ones can we really, really try to get in first.
It sounds like for the corrections, you're planning to have a joint meeting with the Secretary on private prisons. The issue of Hep C, but also behavioral health and reentry. Corrections is a very active participant in the Behavioral Health Collaborative, and Bryce Pittenger is now the CEO of that, as I know you know, Amy. And so I'm kind of thinking a bucket of behavioral health might be for one meeting, and it would be a pretty rich agenda. And I don't know if, hold on, sorry. So that would be one thought I had on that, and that Medicaid may be another big bucket.
Yeah, some of the, and that gets into some of the other suggestions from like looking at the Loveless Hospital, Medicaid hospital, and that report that went, I think Jane, were you going to say something about that? You followed
Yeah,
up on health.
I did follow up, and I think there is a version of the investigation that's redacted that could be shared. But I wanted to make sure that in terms of confidentiality and issues, because there was a formal investigation, and by the Division of Health Improvement, which licenses hospitals and works very closely with the Centers for Medicare and Medicaid Services. So there are regulatory issues involved, but there is the capacity to share that, and I could find out who was the best person to talk about it and what they found. But they launched an investigation as soon as it came out.
I'm wondering, you know, as there's this discussion about inviting folks to the table to help give details, whether or not the subcommittee can kind of elaborate on some of the topics that have been listed. I don't know what they are. Thanks, Kaylee, for reading them out partially. But I'm wondering, like, for example, you know, is there something that the subcommittee would want to see, or is under the topic of substance or like Hep C treatment in prisons? Like, what would be the ideal anti-racist policy that they potentially would consider and have like specific focuses for invited guests to like help inform rather than it being kind of a general presentation, perhaps. For example, I know it's been mentioned kind of expanding access to care, but that's, and there's many pieces of legislation that have been presented, including Medicaid buy-in or the New Mexico Health Security Act. You know, if the goal of the subcommittee, for example, is an anti-racist public measure would be to give access to health insurance to everybody. If we're going to invite someone to the table, we have that as kind of the focus of conversation, rather than or maybe to direct the work of the committee more in a more focused fashion, perhaps. And I guess to do that, I think we need to think about like what is the process of prioritizing this, right? Because if it's 5 different topics over 5 months, which topic do we want to focus on first, and which one do we think is the most urgent, perhaps?
Thank you for saying that. I appreciate it. Yeah, I definitely feel what you're saying. My hope, and this was what I was hoping to get out of it, is, you know, so we have these buckets and we have things that are listed in there. You know, like for instance, we talked about Medicaid. So Medicaid buy-in was one. I know there was a study that looked at it, or it was commissioned by the House. I forget the House bill. I'll have to pull it up. It's on my laptop, but had studied Medicaid buy-in in New Mexico. So I was curious what the results of that was, as far as cost savings or, you know, cost to the state. So, you know, we do have specific questions, and I think it's hard to prioritize right now because there was 2 things we're looking at, like I was saying before, was things that were likely like sort of long and short-term goals. I think it would be tough to prioritize something that's unlikely to happen for another 2 or 3 sessions, because we don't know what the political landscape is going to look like then. And it might be smarter to prioritize something that's likely to be able to be able to get through the next session. So I think it's kind of hard to prioritize sort of the subtopics, and correct me if anyone else feels differently, let me know. But it's kind of harder to prioritize the subtopics until we sort of get a discussion on what the feasibility of it is. And we won't have that until we kind of talk with the sort of the people involved with it, was my impression.
Okay, I was just gonna start listing out what the buckets were that we identified last time, and maybe that will help us to decide which ones to prioritize for moving speakers for like maybe the next meeting. Amy, in regards to prison, that was one of the buckets, but you have that, we're gonna create a joint meeting then, or I'll join the meeting at the same time for one of ours. So both the law enforcement and the health committee will veer off of our regular scheduled meetings and join one. So that will take care of one meeting. So prisons will get scheduled for one meeting. So I'm not going to add this to the list because that was on one of our buckets. Then we had the 1115 waiver. And I don't know what that is, but.
I think the 1115 waiver is under the Medicaid bucket. So I think our buckets are behavioral health, Medicaid, and the insurance.
Yeah, and then we kind of discussed UNM, and we don't have really purview over that, right? So I don't know if that's something we focus on then. That was another big area that unless we, somehow create a way to focus it a little bit more of how the state can help.
Yeah, I think I need to have a conversation with Caroline and ask her, you know, what is the feasibility of us creating some suggestions over a group that we don't have influence over. So if you don't mind, if we can save that one to talk about next time, or I can email you all what I learned from Caroline.
Yeah, and I think the UNM discussion was wrapped into a larger discussion of what oversight does the state have in regards to hospitals and healthcare policy, and what legislative things can be moved. You know, there has been legislation around capping costs for out-of-pocket costs for uninsured patients statewide, and that has moved in California and other states. Or what oversight, or what there were some policymakers who were interested in thinking through what oversight Medicaid or the state would have in state-funded entities getting, you know, ensuring that they're providing, for example, addictions treatment in some form or another for large hospital systems. I think Pew had suggested that there were some things that had moved in that area in other states. So I think it's bigger than UNM in particular, but UNM is a unique organization that gets a lot of state and federal money, as well as Medicaid reimbursements. And what are ways that we could at least we can make statements, we can ask for accountability, other kind of processes or public input processes that we may be able to move forward that are not necessarily changing the granular level of things at the hospital or dictating what it can do, but a broader kind of racial justice statement and set of asks for maybe the legislative health and human, the LHHS committee, or otherwise. Actually, that would be a great group of folks to talk with, the legislators who are on that committee. And I know they met recently around a lot of similar, some overlapping issues. And then we'd also talked about healthcare workforce and other things. And that was really great that we were able to speak with Secretary McCamley today. That was really informative and gave some more insight into some of the questions and thoughts we brought up in the first meeting. And hopefully we can percolate around those and think that seems to be a bucket of sorts, workforce issues. And then some stuff had been discussed around public health infrastructure. And, you know, New Mexico is one of the only states with only a state Department of Health. And obviously, the Department of Health is not in a place right now to think about how it wants to expand and fund a whole lot of other things, but conversations around racial justice and the role of departments of health, you know, that I see some things around there that could be more statements that we make or longer term goals that we'd like to have. Those are some other buckets, small buckets.
Yeah.
I think we'll get to the prisons with our joint meeting. We got the workforce solutions presentation today. So that's like 2 buckets. Another bucket that will be moved to the main council is the land grant management. So I think what's left is Medicaid, behavioral health, Medicaid buy-in, know if we group those together or not, gross receipt tax, And I think that's all of them from the big buckets we identified last time.
What was the gross receipts tax issue?
Oh, I mean, Dr. Angeli may be able to speak to this a little better than I could, but I know that one of the concerns was that you had to pay gross receipts tax on Medicaid patients when they came in for the offices, but you didn't for private insurance. And it was sort of like a discouragement for providers to take Medicaid patients because it was that extra bit of money you're not going to get on top of the other extra bit of money you're not going to get. So.
Yeah, that's what it was.
Medicaid buy-in, as I mentioned, I would frame it more broadly as coverage initiatives to expand access to healthcare coverage for people, including affordability for those who have it. We have these, what's developed in the health system is these increasingly high deductible plans that make it very hard for people, for patients to actually access care. So people forego it because it's so much out of pocket. And there was testimony on September 4th before LHHS on a new Urban Institute study. There was a presentation on the Health Security Act, which had its own analysis, and the Medicaid buy-in wasn't repeated, but that was presented like a year and a half ago. So there are a range of things out there. All of them cost money, and just to be aware of that. But there are different things, and there are a number of folks that know about those, including the superintendent of insurance. I think that's why I raised him as a possible partner here or participant.
And that's one of the reasons. Sorry, looking forward to hearing about it, because I know they were doing studies on this, and often when they do that, I'm curious about the cost savings aspect of it as well. I mean, that's one of the reasons I think we talked about Medicaid buy-in, because we were aware that they had done a study and I didn't know what the results were, or it was commissioned. So I don't know.
So I think we can send an email to Senator Ortiz-Pino and see if we can get a copy of that report if you don't already have it, Jane. If we can send that report out.
Well, there's the Urban Institute report. There was a formal study of the Health Security Act. There were a bunch of PowerPoints that day on both the Health Security Act and the Urban Institute study. I can pull all that and get it for you.
Okay. If you can send that to Kaylee, and then that'll be part of what Kaylee sends us out for the next subcommittee meeting. And then Kaylee and I will work on getting Secretary Lucero scheduled for a joint meeting, and also getting Secretary Toll or I guess he's not Secretary, Director Toll, and Jane, you're going to work on Dr. Bowen and getting a panel of behavioral health.
Yeah, the best thing would be to have a specific date or a couple of options. So maybe Kaylee and you can kind of sort this through and let me know what you want me to ask, and then I'll copy the two of you on the email to request it. And
sounds perfect.
Can we,
yeah.
What does the committee want specifically in the behavioral health space to hear? Let me make sure I have it.
So I think what we can do is Kaylee and I will take from the brainstorming that happened last session and from the things that came out today, and we can put together some very specific requests.
Sounds good.
Okay, so we are at 6 o'clock. Thank you guys so much. If you have any things that you want to go out, please send those to Kaylee or I, and we'll make sure that they all go out in one email to everyone. And we will also send you, actually probably you already have the calendar invites for all of the meetings so far, but and I will also send out the invite to next week's main council meeting. You all are welcome to join that in the audience as well.
Thank you so much.
Thank you guys. Appreciate it. Good
Thanks,
to see you.
all. Have a good weekend. Bye.
Bye.
Bye.